everyone, welcome to Sprinkle for Some Love with a Cause. Today we have Lori Nan here. She suffers from multiple diseases. I kind of want to welcome her on. Hi Lori, how are you?
I'm good. How are you?
I'm good. I want you to kind of start with your list of diseases first. We're going to do her show a little differently. She suffers from GP as well, but that's not where her journey started. Her journey has a lot of diseases along the way, so we're going to start with her list first. And what is your list of diseases, Lori?
I have type 1 diabetes. I have neuropathy in my hands, legs, and feet. I have polycystic ovarian syndrome, endometriosis, GERD. I always forget.
It's
Um,
okay.
Chronic sinusitis, um, liver, fibrosis of the liver, not related to drinking. Oh my goodness.
I remember you said you had endometriosis.
Yes, endometriosis. I have antiphospholipid lipid syndrome and lupus anticoagulant factor, which are blood clotting diseases.
Okay.
Let's see. Bipolar disorder, anxiety disorder, PTSD. Um,
I remember you had hormone ones as well.
what's
You had
yes.
hormone ones, thyroid, I thought, you had told me.
Uh, yeah, I have hypothyroidism, high blood pressure. Um, I hope I'm thinking. It's so easy sometimes when you can't remember.
Oh no, I fully can relate because I myself, for the audience who doesn't know, I have a long list of diseases, so I know, and it's really hard when you're put on the spot to remember them all, especially when you're like chanting them all off and it's a long list. Um, so I can relate to that, and the anxiety that comes with it is heavy when you're put on the spot.
Yeah.
So I definitely can relate. So let's kind of start off with your body. I know that you have a long list. So what was it that first caught your eye? What disease kind of first started tinkering with your body and making things kind of act a little crazy?
When I was a teenager, my whole family suffers from type 2 diabetes, and they get it late in life, usually like in their 50s.
Okay.
But I was showing symptoms of it, drinking a lot of water, going to the bathroom a lot, and everything like that. So my mom would take me to the doctor, and they would schedule this awful glucose test where you have to drink this disgusting sugary drink, and then you have to wait, and then they take your blood, and it's like crazy. It's almost as bad as like the gastric emptying study, I would say. But now like they can find diabetes easier, thankfully, but before it wasn't that easy. So I kept coming back borderline, and then it just kind of stopped for a while. And then I started dealing with my polycystic ovarian syndrome and endometriosis. I got married when I was 23, and we decided to start having a baby right away because we wanted to be young parents. And we kept trying, and so when nothing would happen, we went to a fertility specialist, and that's when I found out that I had polycystic ovarian syndrome, which basically means that my ovaries aren't round; they're shaped like a conch shell, and all throughout them are these microcysts, but it blocks your eggs from being able to drop.
Mm-hmm.
So even though I would get a period every month, it was because I was on birth control. It wasn't because I was naturally dropping my egg.
Correct.
And so we found that out, and we started, a journey that lasted about, I guess, 3 years of trying to get pregnant, doing the fertility shots. I had a couple surgeries on my ovaries, things like that, and just by the time we were able to do our last IVF cycle, um, we were waiting the 2 weeks to see if I got my period or if I was pregnant, and I got my period. So, like, that was all insurance would cover. And we still had to cover a large sum of that money, but I mean, insurance covered the procedures and things. We had to pay for the medications, which were expensive. So we kind of gave up on that, and we thought about adoption. And then we kind of gave up on that and just decided, we'd have fun and be a happy couple. But we ended up divorcing right before I was 30. So I was kind of glad we didn't have kids because, while we were married, they found out that I had bipolar disorder and anxiety disorder. And he was afraid, that I wouldn't be able to handle kids and this and that. So that's why we stopped trying to adopt or anything. And then we were having marital problems, and we were going to go to counseling. And then he decided he just didn't want to be married anymore.
Oh.
And I was like, oh, okay. So at 30 years old and able to have children, I was single again.
Right, trying to
And
figure things out at 30 and single,
yeah,
it's a little different, especially when you've been in a relationship for so long, since your early 20s.
right. Yeah, so it was like, he was my boyfriend for my last year in college, and then he was the first person that I ever lived with. It was weird. And I never lived alone, so I got my first apartment on my own, and that was kind of weird.
So you're finding yourself to actually, like, at this moment in life, to recreating yourself and finding a new way of living and trying things you've never been done before.
Right.
Okay.
And a friend of mine from high school, we got in touch, of course, from Facebook, like everybody does. And, we started talking, and he sent me an email, and he's like, are you okay? And I'm like, I told him what happened, and, so he came to visit me, because I was living in our house at one point before I got my apartment, and my husband was living with his mother, because that's how we worked it out in the beginning. So he came over to my house, and it was scary because, my dogs weren't there anymore. He took the dogs away, and I had my cat, but, so my friend helped me look for apartments, and I couldn't take time off work, so he actually packed my whole house for me to move. It was crazy. So eventually, he and I got into other things, and we ended up being a couple.
Okay.
Which was really strange, and I told him, I said, look, this is what you're dealing with, and I was very upfront about my illnesses. It's not fair to the other person if they don't want to deal with that, and that's just how I felt. And I told him that, I had some mental disorders, and I couldn't have kids, and, this and that, and he was fine with everything, and so we ended up getting married, and the following year, I started getting really, really bad cramps during my period, like really bad. And I was just like, I can't take it. So I went to the doctor, and they said I had endometriosis. And I said, well, what do you do for that? And they said, well, we go in and clean it out, and then, laparoscopically, and then it'll be fine. And I said, well, will it grow back? And they said, well, we don't know that yet. I'm like, okay, great. You're going to clean me out, but you don't know what's going to come back.
And what doctor and what, aren't you in Michigan?
I'm in Philadelphia.
Oh, you're in Philadelphia? I thought you were in Michigan for some reason. Okay. And what doctor was that did that? Do you remember?
Just my general gynecologist that I saw,
Okay.
like,
Because
once
endometriosis,
a
they
year.
know, does majority of the time come back like every time they laser it off. Like that is well known. So to say they don't
Well,
know was just odd to me. That was a red flag to me.
yeah,
Like, how do you not know? Like,
but
we know it does.
I didn't know. Like, I didn't know anyone else who had it. I
Well,
didn't know
right.
anyone
You
else
as
who
a
was
patient are
suffering.
asking, but you're asking a physician who obviously this is his study and this is his how he makes a living. He should know the fact that it majority of the time comes back and should have told you the percentages or the chances of it or the likeliness. But to say, oh, we just don't know, does not actually answer your question. You're still back at square
No.
one. And he
So,
should have given you a mathematical number or a percentage of, well, with some patients, it doesn't come back at all, the ones that weren't severe. With severe patients, it generally does come back. It's just, or a percentages, like 80% of the time it comes back. Like some type of medical answer there. I don't like that. I don't like that he
yeah,
didn't
like,
tell you
and,
and wasn't honest with you because you dove
well, my
into your
second
first
husband,
surgery assuming it
we're
would be
only married
gone.
a year, and he didn't like it. So he went online and started searching for doctors.
See,
And
he's a
he
good
found,
guy. He caught on right away. Like that's not right.
yeah. And so he called a specialist, and it takes forever to get into a
Yep,
specialist.
especially for
So,
a second opinion.
right, and it just takes forever. Like you have to wait. And so finally, I had to have the endometriosis cleaned out 2 more times before I saw the specialist.
Mm-hmm.
And they said it was in my fallopian tubes and it was just traveling back and forth and it was going to keep rebuilding. And I said, well, what do we do? And they're like, well, we keep cleaning it out. I'm like, well, isn't there another option? And when I still hadn't seen a specialist yet, I was going to see them, I think after I had an argument with my doctor on the phone, and I said, look, I'm going to see a specialist next week, and I'm going to figure this out. So I need you to fax my medical records to this number. And, I put, like a thing saying they have permission to send my
Right, the
records to
medical
them.
release form.
And so I went to the specialist. He said the only way to keep the endometriosis from growing further and coming back is a hysterectomy.
Yep.
He's like, but you're 32 and you don't have children. And I said, well, I can't really have children. And he's like, but you're 32. So they kept running tests on me. Like I went for I couldn't even tell you. So many tests I went to see like if it was growing in different places, and I had MRIs and CAT scans and other kinds of tests and everything. And so, it was like they wanted to make sure that if they were going to do the hysterectomy that it was warranted. And I was in so much pain by that time that they put me on Dilaudid at home.
Mm-hmm.
Like and they would refill my prescription without even asking. That's how much pain I was in. I couldn't stand up. I couldn't do anything. And I mean, it was the hardest decision I ever came down to making because I wanted to be a mom. I thought, I want to be a mom. I don't want to do this. But the doctors were like, you're going to get cancer and that child's not going to have anybody.
Mm-hmm.
And I was like, I couldn't do that. Like thinking that I want to have this child, but then I'm going to leave it alone.
Right.
So I couldn't do that. Like, and so finally I agreed, signed up the paperwork. It was the first major surgery I ever had. And they thought they saw some endo on
So how did
my intestines.
you did 3 laparoscopies though. Those are with the tripod surgery for the endometriosis removal, correct?
Yeah.
Okay. And then
But
this surgery, what did they do to remove for the hysterectomy? Was it a Da Vinci or?
it was an old-fashioned cesarean
Oh,
cut from side to side.
Lord, those are hard to recover from even more.
Yeah, I
Okay.
had 50 of those surgical strips on the outside, and a lot of dissolvables on the inside, and it was rough. Like I just was like, I didn't have time to feel depressed because I was in so much pain.
Yep.
So like, but I mean, I was in the hospital for 4 days, which freaked me out because I'd never been overnight in the hospital.
Right, because the
But
laparoscopy ones are same day
my
surgery.
husband stayed with me the whole time. He slept there. He stayed there.
He sounds
He
very
didn't
good and
leave until
supportive.
I left.
He sounds very good and supportive.
So, well, at that time. So, I mean, in the hysterectomy, I was healthy. I got better. You know, then my psychological stuff started kicking in about not having a baby and not being able to
Well,
have
not
a
only that, but
baby.
they did a
And,
hysterectomy on you, so they put you into, they forced you into menopause, and your hormones at
well,
this
now I still
time.
have my ovaries, so
They
I
left
wasn't going
them,
through menopause.
so they didn't do a full
I still have
hysterectomy.
them.
They did a partial.
Yeah, I still have my ovaries.
Okay.
They've never taken them out. They don't really work, so they just figured they'd leave them there right now, and they're not causing any damage to me. So, you know, they just decided to leave them. And then I asked my endocrinologist if I should have them taken out, being that I'm close to 50 now, you know, to go through menopause and things like that. And she's like, no. She's like, you leave them in. And she's an endocrinologist, so I'm taking her word for it.
I would definitely leave them in, too, even through the menopause part, because, I mean, they do have vital use more than just the hormones. But yes, I would definitely leave them. So at this point, you were going through some mental adjustments from just dealing with the fact that you have a hysterectomy and you're not going to ever be able to have children now. And this was obviously a goal of yours regardless, because it was a goal with the previous marriage, it was a goal in this marriage, so it was obviously a goal, you know. And so coming to terms with that, how does that work?
I went to a psychologist every week, and sometimes my husband came with me, and they said, you need to get her another cat or a dog or something. They're like, she needs to feel needed. And, you know, so he already had 2 cats. And he's like, well, I guess we can get her a small dog. So we went and we found a small puppy for me. And it was the best medicine. I started walking around the neighborhood. And I'd play with her and, you know, cuddle her. And she'd sleep with me. And it did help me a lot. And it enabled me to go back to work finally.
Like an emotional support pet is what it would basically be.
Yeah. So I was able to, you know, get myself to start putting my resume out, going on interviews, trying to get my life back to some set of normalcy for myself.
Right.
And so I did it, and, you know, I was fine, and I was healthy for the most part. And then I think it was 5 years after my hysterectomy, and my leg looked funny one night, like my right leg, my foot and my ankle were swollen. But I'm like a klutzy person, so I just thought maybe I twisted my ankle, you know. And so I was like, that's all. And then the swelling and the redness and everything started spreading up my leg. And I had blood work with my doctor the next morning. It was a Sunday that I noticed my leg was doing this. And my leg was like swelling so much and so fast, it felt like my skin was ripping off my leg. And it was burning. And by the time I got to the doctor Monday morning, it was all the way up to my thigh. It was just swollen and red.
It was traveling.
It was like 10 times the size of what it was. So I went in for blood work, and I was talking to the nurse. I said, I have to see the doctor. I know I don't have an appointment. Look at my leg. She took one look at my leg and was like, she called the doctor in. The doctor looked at it and was like, do you have someone to drive you over to the hospital? And I'm like, yeah, my mom brought me. Why? and they're like, I'm calling for an emergency ultrasound of your leg, and you have to go to the hospital, leave now. And so we went to my mom's car, and I hear her on the phone with the hospital saying that they need an emergency ultrasound of my right leg, stat, possible DVT. And I'm like, what the hell is going on?
Right. You're like, I'm hearing all these codes and abbreviation. He knows something.
I'm like, I know stat means fast.
Yep. On
I got
delay.
to the hospital, and they pushed me through registration and everything right back to the ultrasound room, and someone was sitting with my mom doing the paperwork.
Yep.
And I'm like, this is really messed
They don't
up.
normally do this. So what's going on? Somebody say something.
So, and then they said that, I heard a lot of like, we need stuff done, stat, and this and that. And then they wheel me into the emergency room, into one of the private areas. And I have two nurses. One's trying to do an IV. The other one's trying to get me hooked up to all this equipment. And I'm like, my breathing, I couldn't breathe. Like, I felt like I was just, and he's like, the one nurse was like, honey, can you breathe? And I'm like, I'm just a little agitated. I think it's my anxiety. And they put the pulse oximeter on my finger, and my oxygen level was like 70.
Oh.
And they're like, so I hear, we need a CAT scan of lung stat. I'm like, are you kidding me? I'm like, what do I have? I haven't heard anything yet. So I get down a CAT scan. They take me like right away. They do it fast, and they send me right back to the place I was. And they put oxygen on my face, and I was like, what the hell's going on here? So finally the doctor comes in and says, I'm sorry to tell you that you have a DVT all the way up your leg and PEs in your lungs. And I'm like, can you speak English? And they're like, oh, okay. They're like, you have blood clots from your foot to your thigh, and they travel to your lungs.
Lord.
And I said, what? And I was like, well, is this from smoking? And they're like, nope. And I was like, well, what's it from? They're like, we don't know the cause yet. We have to take a lot of blood, this and that.
So now we're on another mission of figuring out what has caused this.
Yeah, at that point, they couldn't, there were so many things it could be that they couldn't tell me yet because the list was too long. So I stayed in the hospital for 4 days. My pulmonary embolisms dissolved, but they created scar tissue, so I have asthma now from the scar tissue. And my legs started going down, and they put me on blood thinners. And I was like, well, what's the deal with this? And they're like, well, you take these as directed, and you go see a hematology and oncologist. I'm like, blood cancer? And they're like, that's just what it's called. It doesn't mean you have cancer.
Right.
And I was like, well, at least you can tell me that. Thank you. He's like, it doesn't mean you have cancer. I needed to use crutches for 2 weeks because I couldn't put any weight on my leg for 2 weeks.
Mm-hmm.
And I got home from the hospital, and then I went to the doctor. They took 17 vials of blood for, anything that you could think of that's blood related, they took for. And I was like, okay. And they're like, this is how we're going to find out what you have and what your treatment course is, and, things like that. And so, they took all my blood, and then they said, we'll call you back when they come in, and you'll come in and see us. And I was like, okay. So I'm like sitting on eggshells wondering what's going to happen. Like, do I have cancer? Am I dying?
Right.
I
feel you, because I've been to hematology, oncology as well. And I was able to find out some magnificent information from my blood from them. And it definitely wasn't cancer either at that time. But the feeling of just knowing that you're working with an oncologist is just scary in itself, because you know what their goal is, and their whole focus is cancer. So if it's not cancer, why am I here?
Right.
So that's what we ask ourselves. Even though there are other things that they specialize in, but cancer seems to be the number one, which is why the oncology part is in their, their whole name of their doctorate. So
Right.
it's scary. It is. So at the end of that, what
Yeah.
was the verdict? What did the oncologist when he or she called you back into the office to say? Did anything come
I
back
have
positive?
antiphospholipid syndrome, and I have lupus anticoagulant factor, which are two areas of your blood that deal with clotting.
Yes. Okay. So
And
how is your
so,
lupus different than regular lupus? Can you kind of explain that for the audience? Because we know what lupus is, but
well,
what's the difference from your
right.
lupus to that lupus?
Well, because it was found in so many lupus patients, it originally was found in there. That was part of the way they diagnosed actually lupus, was to see if this factor existed or not.
Okay.
And so, like, I do have
Is your
some
factor
minor symptoms
active?
of lupus.
Is your factor active?
Um, I don't know. Eventually they have to redo my blood work, but they don't. Once they see that you have it, it doesn't go away. It's like
Correct.
there's no cure.
Yeah, correct.
There's just managing it. And to manage it, I have to take blood thinners every day for the rest of my life.
Okay. And then
So,
what is the other one that they diagnosed? Can you kind of tell the audience about what that is real quick?
well, antiphospholipid syndrome is another. I'm missing certain clotting factors that are needed. And in 90% of patients, it's found when they try to have a baby because they miscarry. And then when they look at the reasons why they miscarry, they pick that up then. Because I never was pregnant and never had a child, it was in my body and it had to come out somehow. And
Okay.
so the DVT and PEs were its way of telling me, "Hi, I'm here now."
Right.
And so,
And how does that disease affect your body?
sometimes it makes you tired. Because sometimes your blood is like so thick, and then other times it's so thin. I have to get blood work done twice a week.
Okay.
They come to my house to do it for me, because I don't go out that much. But yeah, they come here to my house and they test it, and it has to be within a certain range, or they have to change how I'm taking the Coumadin. Like, if I'm taking enough, if I'm not taking enough.
So you have to regulate your own blood between the two of these diseases, basically, and medications that are helping you and manage how they're forming. And your blood plates are constantly replenishing. So this is like probably, that's why they do it twice a week. It's very hard to manage because every 48 hours to 36 hours, you're back into a new window of what are your levels.
Right.
So that's got to be hard, definitely. How did you manage that now on top of all of your other current stuff at this point?
Well, oh my God, I skipped the diabetes. Because I got diabetes in 2008.
Yeah, we kind of started with it, but you did skip a little bit. But so you were on, once you got your first diagnosis for your diabetes, what did they do to treat that?
Well, when I got it, when they finally found out I had it, it was 2008. I was 37, I think, or 36, something like that. And I had gone for a physical because I hadn't had one and my insurance was going to change. So I went to the doctor and they did all the blood work, and height, weight, this, that, and my doctor's office called my phone at work, like early in the morning, and I was like, this is weird. I'm like, hi, it was my desk phone, so I answered it like I always do. Hi, this is Lori. How can I help you?
Right.
And it was the nurse there, Alicia, and she's like, can you come to the office tonight? And I was like, well, I don't get off until 5. And they're like, that's okay. what time can you be here by? And I'm like, well, with traffic and everything, probably not till 5:30. And they're like, okay, we're gonna leave the office open. Doctor wants to see you. I'm like, well, can't you tell me anything over the phone? So she puts me on hold, and the doctor's like, well, if she wants to know, tell her, but she still needs to come in. And I was like, so she told me, she's like, you have diabetes.
Okay.
And I was like, oh, and I'm thinking type 2, just like my family, and it just started earlier for some reason instead of waiting till my 50s.
Mm-hmm.
And I was like, okay. I said, so what, just changing a diet and exercise more? And she's like, no, you have type 1 diabetes. I was like, no, get out of here. Nobody in my family has that. And
Right.
they're like, well, you do. And I was like, well, how can you tell? And they're like, your A1C is 12.5.
Oh.
And a normal A1C for a normal person is 5.
Yeah, I was gonna say yours is like I thought like twice as high, if not more.
Yeah, it was high. So I was like, so I mean, I started going to an endocrinologist, and I wasn't getting anywhere really with them because they sent me to this other place and this guy was like, you have type 2. There's no way you can have type 1. Type 1's only juvenile, da 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 da. And I'm like, that doesn't sound right. Like, this guy is like being an ass. So finally, I found a place at like one of the best hospitals in the city, and I met this endocrinologist, and she's still my endocrinologist. She's amazing.
Okay.
She does everything for me. She tells me, about like if I have a condition and she doesn't think I'm going to the right doctor, she'll tell me. You know, she's very caring, and anything I ask for, is okay and everything like that. So, I mean, that was the first time I dealt with a specialist that I like adored.
Right, one
Like,
that
I
you can
just,
connect with and that could actually treat you and understand the conditions that you have
right.
and have
So
sympathy
then
and
I had the DVT, and she was glad because the hematology oncologist worked within the same hospital system that she worked
so
in.
they could work together now.
Right. So they could talk together and everything because I was sticking myself, to get blood 8 times a day just to check my blood level, like my insulin level, and then, having to give myself 6 or 7 shots a day. So that's when they started talking about putting me on an insulin pump
Okay.
because then I wouldn't be sticking myself more than once every 3 days, and I don't have to worry about, giving myself shots. And then, so I still had to check my sugar, like with
Right, but it
the
becomes
needle
easier
prick,
to
right?
manage than this to micromanage versus a super manage because doing it 10 times a day alone, like who can remember that much every single time? I'm sure you're missing times, and if it's just a lot to handle.
Oh yeah,
10 times, 8 to 10 times a day of doing anything.
right. And it was like, so in 2009, I had lost my job just due to economics in the city. A
Okay.
lot of the big law firms had closed down, and it was like my office, I was the last one hired. So I took 6 months. I'm like, this is good. I'll just take 6 months and collect unemployment and then go back to work. And I just, like, my diabetes was like, I didn't have the pump yet. I wasn't controlled yet. I felt sick all the time. So I decided to file for disability instead.
Okay.
So I filed for disability in 2009, and I just got approved for it last year.
Okay. Congratulations, by the way.
It took 10 years of
Oh,
me fighting all the way up to Superior Court of Pennsylvania for me to get my money.
that is a lot of fighting and a long, very long battle.
yeah, and so between that and my medical problems and stuff like that,
That can add a lot of stress
my
too, just fighting for
my
disability.
husband wanted a divorce. He didn't want to deal with it anymore.
Well,
And
that's
I
not
mean, I
good.
don't want to say that's horrible, but I had to make him say, like, he wouldn't come to me and tell me, as being a husband, I'm like, it's just too much for me anymore. I had to literally pull it out of him.
Hmm.
He's like, I just can't deal with the specialist. I can't deal with the medications. I can't deal with any of this. He's like, I'm done. I've had it. And I was like, I'm just looking at him like, huh?
How do you think I feel? I'm the one that deals with it. Is how I'd be thinking. Like, if you've had it, how do you think I have it? Like, you got in this knowing that this is what this was. Yes, I've gotten sicker, but you also knew that was a possibility.
Right.
You
As I
know?
age, there's always a possibility. As when you're sick and your late 30s, early 40s, things change again in your body. I mean, body chemistry changes all the time.
Oh Lord, you're not lying there.
You know, your
You're
body's
not.
chemistry changes. And
I'm
he's just like, I just don't want to deal with it, and blah blah blah. And so at the time, I was talking to another old friend from high school. I had a lot of guy friends in high school. I didn't like girls that much. They were
okay.
too catty. So one of my guy friends and I, we've been in touch since Facebook started, and so he's like always knowing like I don't feel well or whatever. And it was like the day before my birthday, and my ex, we were separated, but we were living in the same house for money reasons. And then he was going to leave eventually, but for financial reasons, we needed him to stay for a little bit. So we lived in the same house, but we were separated.
Okay.
So I was talking to my friend and whatever, and the night before my birthday, he says to me, he's like, "Can you call me?" He's like, "Something's wrong with mom. I know it's your birthday, so just call me after." And I was like, I know his mom. I worked with her for 2 years at this company, and we had cigarettes together and we hung out together, so I knew her.
Right.
So I was like, "Call me now." So he calls me, and I know he had a problem with alcohol, and he was at the bar and saying stuff, and I'm like, "Look, can you get a taxi home?" And he's like, "Yeah." I said, "I want you to take a taxi home and call me when you get home. I don't want to talk to you while you're sitting on a bar stool." And 20 minutes later, he called me. He was home from the bar. Because he wanted to talk.
Right.
So we would talk and stuff like that, and we saw each other a couple times. And I sat down with him one day, and I said, dating me is going to be a real problem. And he's like, "Why?" I said, I'm sick. I have a lot of illnesses, and this is before GP or any of that. And I
Mm-hmm.
was like, "I have a lot of illnesses." I said, "It's a lot to deal with." I was like, "I see a lot of specialists and go to a lot of doctors and take a lot of meds." And he's like, "I don't care." And I'm like, "Well, don't say you don't care now, because I'll tell you what, it's just going to progressively get worse as I age. And I don't want to be in a relationship with somebody who's going to do the same thing to me again, 7 years after I'm married to him. Like, I just don't want to do it."
Right. I don't want to give you my
And,
all and then you walk out on me.
right. And he's like, "No." He's like, "I don't care." He's like, and one of the reasons he didn't care is because even though he's still kind of an alcoholic, I got him off the bar stool.
Mm-hmm.
He doesn't go to bars anymore. He stays home all the time. But and he really he took care of me when he would stay over, and when he moved in, he would learn my schedule for my medication, and he would be like, "Did you take your meds?" And I'm like, "No, I didn't. Thanks for reminding me." Like, it was weird. Or he's like, "Did you check your sugar?" And he's like, "Do you need insulin?" And he's like, "Do you have to have blood work?" Like, he really
He
became
generally
involved.
cared, you know, which that
And
can
I
mean
was
a
like, "This is
lot
like
to someone
amazing."
who's suffering, especially from multiple diseases. because there's so much to manage that alone and when you're not feeling well, who can remember everything they need to do when they're not feeling well on top of it all, or very fatigued.
Right.
You're just too tired to deal with it sometimes. It's always great to
Yeah.
have that person reminding you or to constantly tapping you on your shoulder like, hey, I noticed you didn't do that yet, did you do it?
Right.
It's just good to
It
have
was like
that.
I mean, he really became involved. Like, as if I had a doctor's appointment or whatever, as soon as he came in from work, and he changed his clothes, he'd sit down and he'd say, "Okay, let me hear the news. What the doctor say?"
Yeah, to
you
have someone
know,
to come home to tell,
and
dealing with it
it
alone
was
when you
like,
don't have like someone to walk in the door and be like, hey, today I got diagnosed with this and the doctor said this and this. Like when you go home and you don't have that, you're just kind of stuck with your thoughts. At least you have someone who cares and be able to come home and be like, hey, this is what happened at the doctor's today. And to go over those things, like, that's a big difference. Because I've had two relationships, one where it was like the other one, like, they were there, but they weren't there. And they really didn't go to the doctors. They didn't really help me. They didn't ask any questions. They didn't care about my meds. They didn't care about whether I took them or didn't take them. It was just too much to handle type of thing. And now I have someone who's completely different where they help me. They make sure I do what I got to do. I go to the doctors. Just all of the above. They take me. They help me recover from surgery. He is completely
yeah,
different than before, like the guy before him. Um,
right. Like, I mean, my boyfriend now, he's just like, I mean, we just celebrated our 10-year anniversary in February.
okay,
And
congratulations.
thank you. And it took a lot of work. I mean, because underlying all of these physical things, I'm still daily dealing with anxiety and bipolar issues and stuff like that. And that's still there, even though I handle things better now
Well, yeah, your
because
body's
I'm open.
constantly at war with
Like, that's
itself. Like,
that's what I learned is like being closed off and not being open about my situation made my depression and my anxiety and my anger so bad because I had to be close. Nobody wanted to hear it. Like the person didn't care. And then we were together for a year, about a year and a half, and we lived with my mom. And he moved in with me and my mom in the house we were living in. And he wanted to get an apartment, and I said okay. And he's like, I want you to come with me. And my mom was sitting there, and she looked at him and she said, I'm going to tell you right now, if you take her, you got to take care of her because I'm not going to be there to back you up. It's on you now. So this is your decision. Like, she was really, like, blunt with it.
yeah,
Like,
I mean, because
this
you're
is
her
your
baby and
decision.
you got a lot of work. Like it's a lot of work for your mom to take care of you still and to help you. And if you're gonna remove her from my home, I'm not gonna run to your house every day and take care of her. You better do that if you want to, relocate her from my home where I help, provide the necessity things
Mm-hmm.
for your medical and help you with your daily needs. Those are all gonna be you now because you're gonna be the one living with her and that's going to be your responsibility whether you're dating her, married to her, whatever. Like if whoever's relocating you needs to know that that's their responsibility. So I'm very proud of your mom for saying that because that's some real shit.
Yeah. I mean, she was just like, she's like, this isn't like, all fun for a year and then it's, then she's better. There's a good possibility she could get worse. There's a possibility that she'll need for like hospitalizations later on because of different issues and everything like that. And
Yeah.
he's like, I know. Like he looked everything up on Google.
He was
He
very
looked up,
informative. It sounds like
yeah,
he knew what he was getting himself into, unlike the last guy who thought he knew, when he really
right,
had no idea. And this guy knew very well and was very informed. That's very I high five him for real because that right there is a lot of work on a man's part. Even just to hop on
yeah,
Google shows that he cares because he's trying to get some form of understanding so he can help you cope. That's important.
right. And it's like,
So
like,
if he was
so
listening, like
that,
as your support system, what would you kind of like say to him if he was listening for being your support system?
that I love him to the moon and back, and he's my rock. He's my everything. I would do anything for him. I would jump in front of a bullet for that man. He's just that amazing. And it's like he was that amazing before I got super, super sick.
Okay.
You know, and it was like, then I got scared again that, you know, oh my God, if I get something else, he's going to go. But, you know, I had to remember he didn't go before. And so, you know, we were having, you know, a normal relationship. We didn't go out as much because I got tired real easy. And I couldn't walk real well. So I went to, I talked to my endocrinologist about it. And diabetics get neuropathy in their legs, their hands, their feet. And it's almost like the blood flow just isn't working. Like it's not flowing well enough to my legs. So I get like a pins and needles, like when your foot falls asleep.
Yes.
But I get that all the way up my leg. And I've learned to walk on it.
See?
Because it's just there all the time. So, I mean, I sit a lot, you know, and I move around a lot. Like my legs, like I won't keep them in the same position for a long time or they will fall asleep. But like
I've been having some similar issues. You're scaring me. My legs and feet. I've been having issues. I'm so scared to go get it checked out again because I don't want another disease. I don't want another diagnosis. Scary. I don't want another pill, another treatment plan. I don't want whatever you got to offer me or sell me, but I do want to be fixed.
See, like what I do for it is, I have medical marijuana.
So do I.
Yeah.
I said that weird.
Because I go, my pain management doctor gives me like, it's not just like, you know, some people, like, my boyfriend just went to this place and he said he had anxiety. Talked to the doctor for a second and they signed off on it. Mm-hmm. Me, I actually have like a real pain management specialist prescribing it for me. And it does help a lot with like relaxation. And that's a big thing when you have neuropathy because you're tightened a little bit. And so when I smoke, I relax and I like I don't feel anything as tight. So I'm not like as like
uptight. Yes, I know exactly what you're talking about. I don't have that as far as I know, but I definitely feel what you're saying. Like my body all the time is so uptight. And like I'm always tense.
I smoke and I'm just
so relaxed and chilled. I can just like my muscles just feel so much better, and that weight off my shoulder is gone.
Like so chill.
So I have a question for you about GP. I know we haven't got to your diagnosis yet, but marijuana helps my GP personally a lot.
Yeah, it makes me hungry.
I kind of wanted to jump to your diagnosis real quick if we could, so we could also talk about the two of those together. When did you get diagnosed with GP? And I'm assuming it was secondary from your diabetic issue, because at this point you've been a diabetic for years.
I was diagnosed in 2014, almost 7 years ago. It actually started about this time 7 years ago. I was having severe stomach pains. I couldn't stand up. I couldn't eat anything. And as a diabetic, I had to try to eat something. And I wasn't really thrown up, but I was in severe pain. And I didn't want to eat, and I was nauseous. Like, my nausea was, like, so bad, I just cried. Like, I couldn't handle it. Mm-hmm. So about this time 7 years ago, I started having to go to the ER. I was getting very dehydrated, which was causing pain, but they couldn't see anything else. And then one night, we went out with a friend of ours, and I was just drinking club soda because I wasn't really a drinker. I like to get high even before I was allowed to. So, right. I didn't drink. So I had some club soda, and I started feeling really nauseous, and I'm like, from club soda? And then I asked them for a bottled water, like maybe something from the pipe or like wasn't good. So I started drinking this bottled water, and I asked my girlfriend to take me outside, and I threw up all the water, all the seltzer, just came right back up. And I'm like, nothing else was in it. It was just water. But it was like a lot came up, and I was like, oh my God. And of course, the next day I was dehydrated, so I ended up back in the emergency room. And at this time, I just had signed up with a new family doctor, and I hadn't even seen him yet. I had an appointment with him for like 2 weeks out, and I was so feeling bad. I was hot, and I just couldn't get off my couch. I was wrapped in a ball.
Mm-hmm.
And I called my new doctor's office, and they're like, can you come in now? And it was walkable from my house. And my mom was on her way to my house. She had an interview in Center City, and she was coming out to see me before she went home. And I said, well, I'll be walking on Ridge, so just watch for me. And I got to the doctor, and he sent me over to the hospital, and they ended up admitting me for 3 days.
Okay.
And they couldn't find anything. They tested me for Crohn's, colitis,
Everything in the book.
C. diff, SIBO, everything.
Okay.
And there was nothing. So I got sent in from the hospital. I went to my follow-up visit, and my new family doctor had called my endocrinologist, and they had a conversation. And he's like, I spoke to your endocrinologist, and you should have a message from her. She said she was calling you, but you were in the hospital. We think we know what it is. And I was like, oh. And I had taken a course in medical terminology.
Okay.
Very recent. So he said, we think you have what's called gastroparesis. And I was like, are you telling me my stomach's paralyzed?
Mm-hmm.
And he's like, how did you know that? And I was like, because I took a course in medical coding and billing, and part of it is, the terminology and stuff. And he's like, well, yes. So we want to get you in to see this doctor. He's like, here's his number. He's like, call me if there are any problems. And I was like, okay. So I was a little upset, but I looked it up, and it didn't seem to me like I was as bad as the little bit of information that was out there in 2014.
Okay.
And so I was just like, all right, I'll just call this specialist guy. Well, because I was on Medicaid, they wanted me to be seen by just a regular GI, not a special GI, before I could see the special GI, because that's how Medicaid works. So I called my doctor back, and I said, I can't see him because I'm on Medicaid and this. Then he said, okay. He's like, I'll call you back in a minute. And I was like, okay. And he's like, okay, I have an appointment for you in 2 weeks to see him. I'm like, are you kidding? And he's like, no, you're not kidding. He's like, you have an appointment in 2 weeks, and go in and just, talk to him and figure this out. So I went in to see the GI, and he was very nice, and kind of a little goofball or whatever, but okay, he seemed okay. And he's like, you have to do the gastric emptying study. And I said, well, what is that? And he said, you eat radioactive eggs and drink radioactive water, and then we take pictures. And I said, well, how long is it? And he's like, I do the 8-hour one.
Mm-hmm.
I was like, I'll be at the hospital all day? And he's like, yeah. I was like, oh, God. So I, go and I do the test and everything like that. And, my boyfriend couldn't get off. So, he was checking in with me, like texting me every so often, making sure I was okay, and he's sorry he couldn't get off from work and this and that. And I was like, it's okay. I said, he had just had his vacation, so he couldn't take any time off again. So I said, that's okay. And then September 1st was Labor Day, and we moved that weekend. So he had taken the Friday off, and I was going to see the gastroenterologist that Monday for the test results.
Okay.
And he couldn't get Monday off to go with me. And I said, Mom, can you come with me to go get my test results? And she said, I can't. I have to work. And I'm like, okay. So I was like going by myself. I was
Right.
like, you know what, it's okay. I'll be fine. I've gone to a million specialists. This can't be that bad. And so I walked in and, I saw the doctor and he's like, you do have gastroparesis. He's like, we're going to start you on some nausea medication, some cramping medication, some diet changes, little things like that to see how that helps. He's like, I'll see you every 2 months. We'll run some more tests. We'll see what's going on. He said anytime you do feel sick, like for more than a day, he's like, go to the ER, you'll be dehydrated. He's like, no, it seems to me you go to Roxborough ER. And I'm like, oh, it's literally right down the street from my house. At that time, I could see my house from a hospital room. Like, that's how close I lived.
Okay.
And I live that close now, but I just can't, I live in a different direction now.
Okay.
So I was like, okay. So he gives me all the information and, all this stuff. And I'm still keeping my face, I'm shaking a little bit and I'm trying not to cry in front of the doctor.
Right, trying to keep your composure.
And I'm just trying to keep my composure because, it is what it is. And now I have a doctor that'll work on it and fix it. And so I go out to my car and my boyfriend was texting me, you should be done by now. I haven't heard from you. My mom texted me. She's like, where are you? I thought you were done earlier. And I sat in my car and I cried for half an hour.
I've been there. Couldn't tell anybody what it is.
Screaming.
You have to absorb the knowledge that you've just been given in before you can process it to spit it out of your mouth to tell somebody. Like,
Right.
I want to tell you, but I don't even know how to tell you what the heck it is, and I haven't even processed what the heck it is, and you kind of have a conversation with God at that moment, I kind of say, and I start having, all these thoughts of, why, how, when did this happen? Where did I go wrong? Or what did I do? Or what did I take? Or how did this, what can I do to get rid of this? Or should I even tell anybody?
Right.
All these random thoughts at one time are just, speed racing through your head.
And I was, punching my steering wheel, and I was so mad. And I was so upset. And so finally I stopped crying, and I texted my boyfriend, and I said, it's bad. And he said, okay. He's like, I'll try to get out of here as early as I can to get home. And I'm like, okay. And I said text the same to my mom. I said, it's bad. And she's like, all right. She's like, I'll call you on my way home from work. And I understood because they have jobs to do.
Right.
And so I went home and I just cried and cried.
But sometimes we need that space to ourselves just to cry, like you said. We need that sometimes to process this.
Oh my God, yeah.
And just to be able to have that, sometimes it sucks. Sometimes we feel but sometimes that's exactly what we need to be able to get back up on that horse and give it another shot,
Yeah. And I was like, what do I do now? And then, I ended up having, a lot of ER visits. And I was in the hospital for a week right before Christmas because I had acute colitis on top of the GP. And it was making me really sick. And I couldn't, keep anything in, and it was a mess.
Right.
So I was hospitalized for a while until they even figured out that it was colitis. I was like, you mean the colitis kind that everybody gets and doesn't go away? And they're like, no, this is just an infection. We're going to give you antibiotics. But it took them 3 days to figure it out.
Okay.
And they knew a little bit about GP, but not really. And I gave them my doctor's phone number, and they did talk to him and everything like that. And so I was on my my nausea medicines and everything while I was there too. And I was like, all right, well, I got to change the way I eat, and I got to cut things out of my diet. I got to do this and that. And I started following the GP diet, kind of. Softer foods, no meat, no this, that. And, I still was getting sick on and off. And I was like, you know what? If I'm going to get sick, I'm going to enjoy my sick. So I started just eating, not whatever I wanted, but certain things that I wanted. I just started eating them and eating them. And some that made me sick, I took off my diet, and others that I can still handle, I eat. And it's like I don't follow a specific diet because
Yeah,
it's too
everybody's
much.
GP diet is a little different because it's kind of more or less like there's a list of food that is generally categorized that most GP patients it irritates with, but not all. And it's kind of more or less everyone has to go through their own elimination diet where they see what bothers them. And if it hurts
Right,
you, then no. If it doesn't, then yes. And it's kind of like
right,
A or B. And some people can have spaghetti. Some people are like, oh no, that red sauce, oh no, gotta go. Cannot have spaghetti. Some people can have coffee, and some people are like, oh no. Some people are like, I can have starch and pasta, and some people are like, no, no starch, no pasta, no rice. So like it just kind of depends on what stage and phase your body's in. But for you, you're a
right.
diabetic. So for diabetics, it's a little bit different because no matter what
There's
you
the
do or don't
See, that's
do,
the problem is there's the diabetic diet and then there's the GP
well,
diet.
those are two different diets, but there's a third issue of what I'm discussing. So there's like a order of operation within the disease itself, and GP can your diabetic can cause GP because it causes more certain nerve damages and things like that that are there that make it more permanent, like present, versus where other GP patients that aren't diabetic they go through more of a flare. Where certain diabetic patients they have a flare, but whether you do, no matter what you do or don't eat, your diabetic is going to determine like your GP. So whatever your sugar levels are,
Uh-huh.
your whatever. So if you're diabetic, your diabetes is acting up, then your GP is going to act up. If you have your diabetes in
Uh-huh.
order, then your GP will be in order. And it's kind of like a 2-for-1 deal now. And your GP will follow whatever your diabetes is generally doing most of the time, unless you get further damage or you start having like other issues with like being able to use your bowels and things like that, then you're looking at a deeper issue with more other diagnoses, which is a different phase and stage. But like for the stage and phase that you're discussing, it sounds to me like you fit in the criteria of the diabetes kind of runs your GP, and your
Yeah.
your your diabetes diet runs your GP. Because if you break your
Yeah.
diabetes diet, then your GP flares, and whenever you're in a flare, then you have to follow your GP diet because now all of those no's will bother you. But whenever you're not having like if you have both of them in order, you can eat whatever you want, doesn't matter what list it's on. But whenever your diabetes is acting up, you really have to follow that GP list or you're going to make a bigger problem for yourself. More pain, more issues,
Right.
more your GP is going to flare more. Like you're going to make it flare by not following your diet. So, that's important to learn like the difference in that for your body because if you always keep your diabetes in order, then your GP will try to generally follow most of the time.
Yeah, like right now I started using a new insulin pump and a new continuous glucose monitor
Okay.
um, that is attached to my body, and it sends glucose readings every 5 minutes to my pump. And what this pump does, its new technology, is if I'm starting to go up, it will it will do like a bolus by itself.
Oh, okay.
So it's been helping a lot more with keeping my numbers. Like my numbers sometimes used to go to the threes and stuff like that. And it's been helping keep my numbers more solid than
Yeah.
they used to be.
So now that you'll have a
Because
better grip on the diabetes because with the consistency and it sounds like more or less the machine or computer is doing most of the work for you now. You would before be
right,
dependent on you and own solely you. Which makes it way harder. Like you said, 8 times a day doing this, 10 times a day doing that. Now it's like the machine's doing all of those fabulous things for you.
yeah, it helps a lot. And the hope is that we can get my A1C down because it's still kind of high. But I mean, we're working on that issue, with getting my numbers even down further. Like but I get scared sometimes. Like if it goes down too far, but it's normal for most people. Like I feel a little dizzy because I'm used to running a little high.
Right, your body's
So
normal, what you consider normal. Whenever you go out of that range, your body has an adjustment period, which is why you're seeing
yeah,
like that and you're
yeah,
scared.
and
Like you can
that
feel
can
it.
cause a flare too. Like if like my diabetes acts up, but also like if I get too bad anxiety, like then that'll make me go into a flare if I get too
Yeah,
anxious
I
about
was gonna bring
something.
up that, and then I had a question about your thyroid. Have you ever had any issue? I know you got diagnosed with thyroid disease, but what was your issue with thyroid disease? Like, did you have to take any
Um,
medications or treatments or what?
yeah, I have to take medication every day. My thyroid is underactive, so they have to give me medicine to make it a little more active. So I take it's called Synthroid, and
Okay.
then they test my thyroid numbers, and they've been great. Like I've been, it took a little bit to get them therapeutic when they first found out, but now there's no problems with them at all.
Oh, that's a blessing.
Yeah,
To
so
be able
the
to get that in
medication
control
works,
so
and all I
quickly.
have to do is pop a pill, so it makes it easy. Like some things, it's like the pill works for, like I take a couple things for my cholesterol, and because my triglycerides, because of being diabetic, um, they were extremely elevated. So I take a normal, like, um, uh, what was I saying?
About your medications for your cholesterol.
Oh yeah, they added one, and so now my like those numbers have come down, but my triglycerides are still kind of high. But it's worked. Like the therapy is working that they're giving me because they don't want to give me too much because then it could turn the other way.
Right. It sounds like you have really good
So
doctors who are managing like all of your diseases together, and that's amazing. Um, Speaking from someone who has multiple diseases, it's so hard to be able to have such a good team that's on top of it and able to see such good results in every aspect. I would continue doing what you're doing. Do you have any procedures or any treatment plans coming up in the future?
well, right now, being that my GP is stable, they don't see any. Just keep taking the medication. But I did find out I have chronic sinusitis,
Okay. And what's that?
which is like people get sinus infections and they go on antibiotics and then they go away. Um, I'll I'll go and get an antibiotic for my sinus infection. It goes away, and then 3 days later it comes back.
Okay, so you're like a constant flare
Yeah,
of
like
sinuses.
since my boyfriend says since January, I've had at least 1 to 2 sinus infections every month,
Okay, so it's like a
and
week on, a week off, a week on, a week off.
yeah, and it was horrible. And the antibiotics for GP patients are not good because your stomach does not like them. And it's like I was just like, it's time for me to go see a specialist. So I went to an ear, nose, and throat doctor, and she checked everything out, and she showed me her little scope that she had to put up my nose, and I kind of laughed at it because of all the tubes, like you get down your nose and stuff like that for our disease, like to check things. And she's like, "Well, this tube, is this gonna bother you?" I'm like, no, it was like so tiny, I didn't even know it was there.
Oh, lucky.
So she looked, and she's like, "You have an active sinus infection right now." And that was the first time I was seeing her. And she's like, "When was your last sinus infection?" I was like, 2 weeks ago. She's like, "Okay, well, let's do a CAT scan of your sinuses." And by the time I got in for the CAT scan, I just finished the antibiotic that she had given me, so my sinuses were clear. So
Okay.
on the CAT scan, there was nothing there. And then what she did was she was like, I got to check because she's like, "You sound really congested. She was like, so let me check. She's like, your sinuses are fully in. So between June 2nd and June 8th, which is a 6-day time period, my sinuses were all inflamed all over again.
Oh, Lord.
And she's just like, okay. She's like, well, she's like, I think it's time for us to do some surgery. And I was like, okay. And I asked her what she was going to do. And she explained it very thoroughly. She's just like, what happens is the passages to your sinuses get almost closed. And so when they fill up, they don't drain like everyone else's, like blowing their nose and, everything like that. Yours stays there, and it slides down your throat partly because you can see it coming down your throat. And it causes you, like, your voice being messed up and, all these infections and headaches and everything like that. And I was like, okay. So she's like, they have to make the openings wider so my sinuses will drain by themselves.
Okay, that makes sense.
And then I have a deviate septum.
Okay.
Which a lot of people, like, I had a couple tubes down my nose that could have caused it, but the septum is up by, like, the bridge of your nose.
Okay.
And if it's not straight, if it leans one way or the other, it cuts off some of your breathing. So I was snoring, and I didn't know I was snoring. My boyfriend was just like, you're snoring. Stop snoring. I'm like, I'm snoring? Like, I don't know what I'm doing. I'm asleep. So, and I was like, you snore too, so shut up. And so she's going to fix that. So that surgery is July 20th.
Okay.
I will get my sinuses fixed.
Well, that's good. July 20th. And where are you having that operation?
It's at a hospital called Chestnut Hill Hospital. And it's like on the outskirts, like on the suburban part of Philadelphia.
Okay. So I'm definitely interested in doing a follow-up for that if you're interested.
Sure. I mean, the first week probably will be really rough because I won't be able to talk.
Of course, I would like you to recover. Whenever you're fully recovered and you feel ready.
I'm looking forward to being able to smell again.
That would be awesome.
I can't smell anything. It's like, and I was like, can't you smell that? I'm like, smell what? Like, what are you talking about?
Right.
And he's like, the cat just went in the litter. We were standing by a litter box, and the cat just came out. And he's like, oh. And I'm like, what? He's like, oh, God, that stinks. And I'm like, what?
Like, I really don't smell it.
He's like, you can't smell that. I'm like, smell what? So he jokes around with me a lot, but he took the whole week off for my sinus surgery.
Aw.
Because it's on a Tuesday, so he took the whole week off. He's off Monday, so we could do, like, all the prep stuff, like, change the sheets on the bed and get everything set up. And then my surgery's Tuesday, and he'll be home with me the rest of the week.
Aw, that's a great man right there. That's
oh my
for
God,
sure.
He's awesome.
Between him and your mom, it seems like you've had amazing support, and, like, your mom's also been one of your go-to people.
It's like that, but some things within the family have changed in the past 6 years.
Okay.
And, like, her and I used to talk to each other every single day on the phone, every day, no matter if we both worked or not. Like, we would get our coffee in the morning when we worked, like, at our desk and call each other in the morning and stuff. And we were out of touch with my brother, and my mom found out that he had a baby. So she wanted to get back in touch with him and meet the baby. She wanted to be a grandmother, and that's awesome and stuff like that. But then, like, she would use all of her vacation time to go visit them. So then she couldn't help Alan with me after surgeries.
Okay.
So that made it kind of difficult. Like, Alan was the only one.
Right.
That was doing stuff. And he didn't mind. Like, it didn't bother him. But it was like, your mom should save a vacation day, at least one, in case of an emergency. And so now my mom's going to Florida right before I have my surgery, and being that they're still having outbreaks of COVID and things are really still crazy down in Florida, she can't see me the first 2 weeks she comes home from Florida. So
Okay.
she won't see me after my surgery. She can see me the third week after my surgery.
Why
Because my
2 weeks?
doctors are
Because I
like,
know that
no.
you can test for COVID, and generally they say within at least 7 days. So, like, why 2 weeks though? Why not a week at least?
My doctors were just like, you have to go by original
Oh, the doctor
quarantine.
said 2 weeks. Okay.
Yeah. My doctor was just like, because you're going to have open incisions in your
Yeah,
nose.
yeah, it would be good to wait 2 weeks. You're right. To be honest on
And it's
that.
not like, I mean, if it was a different surgery and I could wear a mask when she was visiting and she wore a mask, it would be different.
Right, but your
But
open
I can't wear a
incisions and all
mask
of that,
because
and
it goes across my nose. So I can't, wear a mask right away. So
right,
it's like,
you have
I
to
mean, I
heal.
told her last night and she was okay with it. She was just like, well, she's like, your health is more important than anything. So, and with
Right,
all of our health problems, COVID's really bad for us.
definitely. My son's going to Florida now, actually, and I'm a little scared for when he gets back. Like,
Oh gosh.
like I hope he doesn't come back with COVID. Like, I get scared. He goes to the Florida with his dad like twice a year though, on a
Oh,
regular. So
okay.
I'm like, ugh, I hope everything goes good. I get nervous every time, but there's really, I mean,
Oh yeah.
you know, we still have to live life
Yeah.
with or without COVID.
I know.
It
Yeah, I
sucks.
know. It's like, I mean, that's the thing. It's just like, I do like go out now. Like when it first like came, like I self
Oh
quarantined for
yeah,
5 months.
I was locked in. I didn't let anybody come over. I had just moved into a new house right before COVID hit.
I remember seeing the picture
Yep, and I
when
didn't
you
let
lived in
any of
it.
my friends come over and see it or anything for a while. I had like one or two friends in the beginning try to like sneak their way over, and I was like, "Ah, okay, we can wear a mask and I'll let you in for 10 minutes. Wear a mask, I'll give you a tour of the house, but then you gotta go, girl." And I was scared then. And even after those two little sneak peeks, I felt so guilty and scared. Now I'm not as so uptight about it. But I did test positive for COVID one time, but I didn't know I was positive because my test came back. It was like an abnormal positive, so it was false at
Okay.
first. And then they made me repeat the test, and then I was told it was negative. But then, like 3 to 4 weeks later, it was more like 5 weeks later. They had called me to ask me about my experience with COVID and do like a survey. And I said I didn't have COVID. Well, then they went back and the health department confirmed that I did. And then the other place, so I guess they retested the abnormal one. They sent it back off a second time. And I'm like, but then I have a negative from the same day, which is after the positive. I have a positive from one day and then the next day a negative. So it doesn't make sense to me. So I feel like didn't have COVID because nobody else in my household did, and I wasn't told about it until like a whole month later. And the test came back the following one the next day came back negative. So I don't really know how that works because I would have known if I had COVID because before we moved here, I had posted like in October to November, right before I was moving when I was packing my house. I had got so sick before we even knew what COVID was. And I felt like I was dying. I mean, I was sick for days, didn't eat, couldn't, was sick, and that was horrible. And then one day I just woke up and all of a sudden I just started feeling better. And then every day I was feeling better and better. And then the next thing you know, I packed the rest of the house and we moved. And then we heard about COVID. And I kept thinking, I think I had COVID back then, when before we knew what COVID was, right before Christmas, right into 2019. But 2020
Right.
came and in January, and then it hit. But yeah, I definitely thought that I had COVID then. But anyways, off of that long
I got
topic.
that. I got vaccinated.
You
My
did?
doctors, yeah, my doctors said that
I've been
they can't
scared.
tell me to get it, but I will die if I get COVID.
So did you get both vaccinations or one or two, and how long ago, and how did that work for you? I'm kind of wanting to know.
I got my first shot in February and my second shot in March. I got the Pfizer vaccine.
Oh.
And I was pretty okay with it. It gave me a headache and it made me like I'm always tired, but it made me like extremely tired. Where like I would fall asleep at like 9 o'clock at night.
How long did that last?
My boyfriend ended up getting it too, and he found out that he was having it the same day as me. And so we both got vaccinated at the same time with Pfizer, and so it was the same dates both times.
Okay.
He just went somewhere else for it, like his work somewhere.
So how long did you notice you were fatigued for?
Like a week.
Okay, so kind of like a mini virus within your body, kind of was a little felt like it was winging on you, but not nothing heavy.
And he was tired too. So we went to bed early a couple of nights, but
it was dealable. It sounds like I would if that was really the only symptoms that you had, I would probably do it. I've been scared and I've been considering it, but I was like, I've got all these multiple diseases, and I haven't really run across someone else other than you who has a long list of diseases that has also taken the vaccine, because they tested the FDA on people who are sick, like, and here and there, but people that are as sick as we sick, like, I need to know the difference, because some people's version of sick is not the same version of my version. So I'm like, if it, I'm a little scared there. So I've been scared. My mom went and got it, and some of my other family and friends that I know have, and I'm kind of at the point where I'm contemplating. But I'm still not ready to take that leap yet. But I think maybe by Christmas time, I'm going to take that leap.
Yeah, I mean, I'm glad I did it, and I understand where my doctors are coming from, because, like, I have asthma, and it's just, people with the breathing issues and the diabetes and everything, our bodies are so weak because you're constantly fighting a battle.
Mm-hmm.
It's like with all these diseases, most of them are autoimmune.
Correct.
So my immune system is shot. It can't handle a lot.
Yeah.
And it's just like, I sent an email to my endocrinologist, because if I was going to trust anyone, it would be her, to tell me whether or not I should get the shot.
And she advised you?
Her nurse called me back the same day, and I was like, hi. She's like, hi, how are you? Because I've seen her before and stuff. And I'm like, okay. She's like, well, I'm answering your email. And I was like, oh, you could have just emailed me back. She's like, that's what we've been doing with most of our patients, but you're a different case because of your multiple illnesses. She wanted me to call you and tell you definitely need to have it done. She said between all of your diseases and your problems and things like that, she's like, you won't come out of the hospital if you go in.
Correct.
And I was like, okay. And it's like, she's like, we can't make you do it, but we can give you the best medical advice for it. And for you, it's a positive thing to do.
Yeah.
And so once she did that, like, I signed up for it the next day, and then I had it done the following week. That's how fast they got me in.
Good, quick, fast, and in a hurry. Good service.
Yeah, they got me in and out of there quick and fast, and they were really organized and everything.
Well, I like that. I am looking forward to following up with you and doing this update in regards to your sinus, that's for sure. I've got a question for you before we head on out. If you could, give some form of moral or mental support to someone who's fighting multiple diseases like you or I, and they're kind of ready to say, screw this, I can't do this no more, I'm done, I want to give up, what would you kind of say to them to give them a little more hope?
I would just tell them, keep the fight. Keep up the good fight. And the biggest thing I've learned is if you get bad news or another diagnosis or something like that, give yourself 24 hours. Give yourself one day to cry, to bitch, to moan, to not talk to anybody if you don't want to talk to them. Just give yourself a day. And that day is so therapeutic.
Mm-hmm.
because you're not talking to anyone. You're not getting anyone else's, like, oh, you're going to be okay. They're going to work on it. You're not getting any of that stuff that you don't want to hear for a day. And you're just letting yourself cry it out and say, oh, but then when that day is over, say, okay, now I got to fight.
Yep, I gotta
Now
get
it's
back
time to
up.
fight. I got to pick up my big girl
Yeah, I
panties
like that advice.
and I got to fight.
I definitely do. I often
And
feel that. I really feel like that cold heartedly, like full heartedly, not cold heartedly. I think I said that wrong, but I mean that full heartedly, because I do that, and I also find it to where it makes it easier if I just make like a Facebook post in my support group or wherever I feel comfortable at about it. So I'm not I have so many people that want to know like, oh, well, what the doctor say, and it's like I don't want to repeat the story 500 times today or 5,000 times today. So I kind of just do
right,
like a simple post, put it up there, and then I kind of go into like a do not disturb mode, where I do take that time. I put it out there so people aren't like pestering me, but then I take that
right,
time for yourself because that time to identify with your body and the realization of what's going on is so important, and to be able to get back
totally.
up, you know. I kind of wanted to say something else before we end this. Her and I spoke before we kind of started this, and I mentioned something that I wanted to bring onto air. I've been really considering trying to figure out and design a ribbon for people with multiple diseases because I feel like I shouldn't have to, she shouldn't have to support 10, 20, 30 ribbons, a red one, a green one, a blue one, a teal one, two green ones, a light green one, a lime green one, a dark green one, like whatever color that we're supporting for our multiple diseases. Um, I kind of just want to create one that is for us, that is something we can identify with, and that we can coordinate with. I haven't really figured all of this out yet, but I've been kind of coming up with some designs and some plans, and I kind of want to be able to have it where people can pick multiple colors to put on theirs with multiple diseases, not just one that says multiple, because I want people to know what those multiple diseases are. I want to bring awareness to that. We are suffering, and our bodies are at war every day with our bodies. Then we have to fight life itself, like our marriages, our bills, our rent, our DHS, if we're looking for assistance, whatever, medical insurance companies, pharmaceutical companies that we're trying to figure out how to get this medication approved, we depend on, how to get a prior
Right.
authorization. Just there's so many battles within the battle that we don't even see the bigger picture sometimes. And to be able to step back and just USA and like take a moment for yourself and love yourself and recognize that this is okay and that we can do this. We often, like when someone asks you, Lori or I, what all do you have? We get brain fogged. We get flustered because it's like, first of all, do I want to say it all? I don't want to sound crazy. I don't want to sound sick. I want to be normal. So I don't want to say all that stuff because then you're not going to treat me like normal. You're going to start like, oh, I'm so
Right.
sorry. And it's going to be okay. And oh my God, girl. And you start getting the sympathy shower, and I don't generally want the sympathy shower. You asked
No.
me a question, I just was kind of answering. I wasn't really searching for anything, but sometimes we don't want to answer those questions, or we're so scared to tell the world that we fight all of these diseases, so we keep them to ourselves and we deal with them alone and shadowed, because I don't want to tell everybody I've got this and that and that and this and this and this and this and oh yeah, I've also got. And eventually you're starting to speak a foreign language because sometimes people don't even understand half of these diseases or diagnosis, or what even it is or what it does to your body. So it's like now I've got to
Right.
explain after you ask me, like, what all is it that you have? Then they're like, oh, well, what is that? What does that do? Now you're like giving a doctorate lesson in like a class in diseases of what it does and how, like, those aren't things that we get comfortable with. So we find ourselves shadowed up or boxed up, or just, oh, I have thyroid disease. Oh yeah, we're talking about lupus. So yeah, I have lupus. So we just define ourselves to that one disease that we're currently talking about. I want to shine awareness on all of our battles, all of our diseases as a whole. Because as a whole, every day you wake up and you're fighting every single one of those, not just one. You're fighting GP, you're fighting diabetes, you're fighting neuropathy, you're fighting endometriosis at times, you're fighting polycystic ovarian syndrome, you're fighting PTSD, you're constantly fighting. Like, there isn't a day you wake up and there's not one of these diseases ain't going to choose today to mess with you. It's kind of like you're in a school with multiple bullies and you never know which bully is going to come around the corner next to get you. And you still got to make it to class because truancy is real. So it's like, what do you do next?
Yeah.
You know? And you can't fight, you're going to get suspended. So it's like, what do you do? So you got to find a way to tiptoe around all of these diseases and still get your whole goal of every day accomplished, whether it's waking up and feeding the dogs or taking care of the cats or taking the kids to school or, running off to the mall to get some clothes for a wedding you have in a couple months or, whatever. So it's like, we have to do those things. And our body, I don't think people realize the fight that we do just to get up and eat 3 meals a day and use the bathroom. That alone is a lot.
I know.
And just to be able to digest those and to, just to live the things that people take for granted that they just get so freely every day, like to wake up and have a clear headed with no negative thoughts, no bipolar stuff eating at you or PTSD bothering you or hanging over you or the emotions of the diagnosis hanging over you, or the shadow of what tomorrow is going to hold. Like, those are our real fears and anxiety every day. It's not like, oh, what am I going to wear tomorrow? I wonder what color my hair should be. Ooh, does this eyeshadow look good with this outfit? Like, those are not my thoughts. Although they are sometimes, I like to look good. I like my makeup. Those things help me feel good. But those aren't the real thoughts of the day. The real thoughts of the day, those are the things I do to get through the day. Like, let's not think about that. Just do your makeup instead, girl. Don't think about how much you're going to vomit today.
Right.
Let's just do your makeup and look cute until you start vomiting. You can be cute for a minute. Get some Snapchat pictures in before you start spitting up last night's meal.
Yeah.
So it's like, taking those moments are so important that I want people to understand that. And bring awareness. So if somebody out there is suffering from multiple diseases and feel anything that we just said is like, oh my God, yes, 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 reach out to me. I want to hear your story too. I want people to hear like what you have going on and how you're fighting. And how are you fighting? Like, every fight is so different.
Well, maybe
Go ahead.
Maybe we need a Facebook page.
Well, I have a support group called Sprinkle for Some Love with a Cause, which follows like the podcast. And that's kind of where I've been doing some of the support. I don't know if you're in there yet or not, but now that you're on the podcast, you'll definitely be added to that support. And anybody who's looking to join that support group, there's a link provided on every podcast that shows the support group. It also shows the Facebook page for that, and it shows a nonprofit organization website, and we also have a store with merchandise for it. We're still evolving.
Cool.
There's we do like a post on there. It's kind of like a biography or whatever, but it's not fully, it's just something we just started launching where I just started kind of doing like random posts on there of what's going on and what we're currently doing. But that website and that .org is going to continue to evolve as well. So anybody who wants to join any of those, feel free. And if you want to hear Lori's follow-up story, it will also be there and on the podcast when we do it. This podcast will be posted and aired before morning, and it'll be like on iHeartRadio, Pandora, Alexis, Spotify, Apple's, like anywhere pretty much where, podcasts are played, even FM radio.
Right.
So I look forward to more, and I really like your vibe, Lori, and you're definitely a fighter. I want you to keep on fighting. For real, like this is.
Thank you so much. You're a fighter too.
Thank you.
You got it going on, girl.
Thank you.
2 kids, a man.
Aww.
The dogs. You got it going on.
Yeah, I definitely got a lot going on.
You handle it with grace.
Thank you.
You handle it with grace.
Thank you. We all try.
And it looks like you have a good man too that takes you out on a boat and gives you a nice morning.
Yeah,
get your mind off everything.
My hubby definitely loves me. We were kind of like you and your hubby at first. We started off as friends, and then it just kind of worked its way into a relationship without actually intending to be one. It was kind of supposed to just be a little fling, and then that fling turned into the real thing that later came with a ring. So yeah, he's definitely been incredible to me. He has a mom who also has GP, and she
Oh
suffers
wow.
from multiple diseases as well. And he was fully aware of what he was getting himself into. And he had just recently lost his father at that time to cancer. Lung cancer. So he had
Right.
helped his father through
Oh.
the battles. When we got into a relationship, we had started taking care of his mother together. And now his mother, one of his sisters, take care of his mom because of my medical conditions and the kids. It just became too much at one point. But we rotate back and every few years back and forth and on now. I think we're trying to figure out when our next schedule is when we'll have her again. So he's fully aware of the battles and how to
Right.
take care of someone with a severe illnesses. Um,
Yeah. I mean, my boyfriend is just like he just learns, and he listens to what the doctors say when I'm getting discharged and stuff like that, and he just like and 3 years ago, I was getting ready for my biggest surgery I had for my GP, and his mom lives out in Pittsburgh with his brother in a nursing home, and she got really sick. And I said, well, I don't have any testing for the surgery coming up this week, so let's go. And we drove out to Pittsburgh, and while we were there, she passed away, but he got out there and saw her
that's
that one last
important.
time. I wasn't going to let my illness stop him from seeing his mom.
Yeah, see, that's so
There was
important
no way.
to be able to know when it's time to
It's like
let
he supports
them care
me.
for someone else.
He like supports me through everything.
Mm-hmm.
I mean, until I got my Social Security, he paid all the bills.
See?
I had no money. I was continually broke. So when I got my money, I bought him a car.
Ah, see?
To tell him how much I love him.
See? Yep.
Yeah, he's a spoiled guy.
Yes, me and my hubby do little things like that.
But yeah, it's like.
So definitely. Yeah, I'm so
Yeah,
glad though that we
like we
both
don't
have
do big
good.
things or anything, but
Yeah. So
he deserved it so much for all he did, and
see, and that's my
I
advice.
like
I would give to anybody who's listening, also who suffers from multiple diseases, to find someone who understands your diseases and your body, how like it
mhm,
works is so important because they're marrying the diseases too. They're not just marrying you. They're marrying the fight. They're going to
right.
become part of the fight. They'll be your cheerleader in the fight. They're joining a squad. It's not so
Mhm.
much of
But you
just
have
a
to be open
marriage.
with them
Yeah,
too.
and that's
You have to
where
be like,
you have to be honest
the
and
biggest thing
communicate.
is being upfront and saying, look, this is what I deal with.
Yep,
Even
and
if you don't want to.
yep,
And you don't have to do it on the first date or the second date. If you feel it's becoming a relationship, you sit down and you're like, this is what I deal with. Can you handle this?
honestly, I do
Because
that in
if
the
you can't,
beginning.
let me know in the beginning before I get too attached to
I
you.
do that even before like we date because I feel like I'm the type that will fall in love, and I don't want to fall in love with you before I know if you can handle this. So I kind of just need to know up front before we even start, because
Oh
I'm not
no,
gonna
you're like
fall in
me. I
love.
fall in love
I'm
too.
not gonna fall in love with
Oh,
you to find out that in a couple months you're not really feeling the same vibe, and I done put all this love and manifested all these feelings into you and it and a future, and to only be
right.
heartbroken again. So no, I'm a little opposite. But yeah, and I really like your vibe, Lori. I can't wait to do some stuff with you in the future. I hope that our audience liked
Yeah,
this
definitely.
podcast and definitely enjoys this. But until next time, I will talk to you soon, Lori. And I appreciate everybody who listened to Sprinkle for Some Love with a Cause by Trisha Mullin. Thank you, and until next time, Lori.
Bye.
Bye.